Well, welcome everyone. My name is Kimberly Morgan. I'm the Chief Operating Officer at Equity. Equity is a solution with a mission to provide better financial outcomes for the communities that we serve. And before we jump into today's exciting conversation, I want to cover a few housekeeping items. I just want to remind everyone that at the end of today's session, we will have time for a robust Q&A, and when that time comes, the Q&A will be located at the bottom of your screen. So please feel free to ask those questions when it's time to chat. And with that, I think it's time to get started. So like I said, with Equity, we aim to inspire, educate, and inform the work through thoughtful conversation. Specifically today around Paul LeBlanc's book, which we are excited to have. The book is called Broken: How Our Systems Are Failing Us and How We Can Fix Them. Thank you, Sara. She's got the book right in front of her. And so we're here to discuss the book along with Dr. LeBlanc, our two experts in different fields. We have Lauren McGowan and Dr. Sara Goldrick-Rab. And before we dive into the questions, I'd like to give each one of our panelists a moment to introduce themselves. So we will start with Lauren, and we'll leave our special guest, Paul, for last. So Lauren, why don't you introduce yourself? We're very excited to have you today.
Thanks so much, Kimberly. Hi, everyone. My name is Lauren McGowan. I am the founding consultant of a consulting firm called Revolution Strategies. But prior to that, spent more than a decade with United Way of King County, working on state and local issues related to poverty and homelessness. And now I have the privilege of partnering up with Equity as well as other organizations working to strengthen our social safety net. Delighted to be here today, and I'll pass it over to Sara.
Thanks, Lauren. So good to be with all of you today. Sara Goldrick-Rab coming to you from Philadelphia. I'm an independent scholar. I've founded a number of organizations, including most recently the Hope Center for College Community and Justice and Believe in Students. My research examines various ways to improve college completion with a focus on students' basic needs. And I share Paul's commitment to the idea that students are humans first, and that all of our work should do that with should be done with that in mind. It's one of the reasons that I'm so pleased to be working with Equity for the last 3 years, and I'm glad to talk about this book today.
Thank you.
That's up to you, Paul.
Hi, so it's such a pleasure to be with you. Thank you for having me. Paul LeBlanc, I'm president of Southern Hampshire University, wrote the book that we'll be discussing today, Broken, which came out just last month in September. Sara was a part of that. She was one of the people I interviewed and very influential in my thinking about the topic, and just delighted. And by the way, huge fan of Equity. You were our critical partner through the pandemic and through our HERS Act money, and really helping take care of thousands of students who desperately needed what Equity does.
Well, thank you, Paul, for that introduction. Thank you, Lauren, and Sara as well for your introductions and your participation. So why don't we get started? Paul, you are our guest today, so you're going to get the most of our questions. But I think what all of our audience would like to hear first is what led you to write this powerful book?
I think two things, Kimberly. So the first is my own backstory, right, which is as an immigrant and a first-generation college student, my family immigrated when I was 4 from kind of what some people would call sort of French Appalachia, so hard scrabble, subsistence level farming village in New Brunswick, very rural New Brunswick, in a place that when we would go back as kids still had outhouses and outdoor water pumps, right? So very, very sort of backwards in terms of economic development, or restrained in terms of economic development. So my folks had 8th grade educations. My mom worked in a factory till she was in her 70s. My dad was a day laborer on construction sites. And I had access to high quality, affordable education, which transformed the trajectory of my life. And I have 2 grown daughters who lead lives now that their grandparents could scarcely imagine if they were alive today. So education for me, it sounds schmaltzy. It was like it's the American dream. It was an engine of economic mobility. It unlocked opportunity for me. And I fear and have for a long time that for too many Americans today, particularly new Americans and underserved communities of color, that opportunity is just less and less and less available to them. So that's sort of a backdrop. in thinking about how to reform higher education, I wrote a book the first year of the pandemic. You can say I had no social life during the pandemic, called Students First, which was really trying to think about how might we rethink and restructure higher education, what kind of policies would be required. But in the middle of writing that book, Kimberly, I was haunted by a question that was more existential in nature, which is, why is it that the industry that I love, and which I felt in some ways, that's going to sound corny, for a moment, that I felt like loved me when I was navigating through it as a student, how is it that industry so often comes to dehumanize the very people it's meant to serve? And then I started extending it to think, wait a minute, that happens in healthcare too. That happens in mental health. That happens in K-12. That happens, well, I was about to say criminal justice. I don't think criminal justice even pretends any longer. So then the question became, how do we fix these broken, scaled systems of care in America? Like, what's wrong with them? What happened? And how do we get them back? Because I do think there was a time when they worked much better, but it's not today.
Well, thank you for sharing that. And so it sounds like a lot of different moments led you to writing this powerful book, right? And, and thinking about the book itself and how it will be impactful to those that read it, how do you enact a culture of believing in the students and treating them as humans first in your work at Southern New Hampshire University, particularly in the wake of the pandemic, because I'm pretty sure that drove a good portion of the writing as well. So I'll pause there for your thoughts.
Yeah, so I think for us, from a Southern Hampshire University perspective, which is, of course, the industry in the world I know best, I've been here 19 years, we have built our model on relationship. We've built our model on the relationship of academic advisors to students. We use the phrase academic advisors because that's the nomenclature of our industry, but the reality is they're kind of life coaches. Our student most typically is a 30-year-old with 2 kids working in a full-time job, sort of stuck, not making enough money to take good care of their family, never being able to sort of make enough. So they need to unlock an opportunity. In the past, 80% of those students came to us with credits from prior. They tried college before. They now were in that sort of terrible mix of some credits, no degree, and a bunch of debt. And now they need to come back and unlock the opportunity that didn't work out. That's actually shifting now. It's now 64% of our students who have some credit. So more and more we're seeing adults who have no college experience now trying to get that credential that will change things up. Unlock opportunities. So for us, those coaches, so you go from class to class, faculty member to faculty member to faculty member in a large scaled system like ours, very different than a small residential campus. But the one person who stays with you is your academic advisor, is your learning coach. And it's 20% academics and it's 80%, Kimberly, how you doing? Like, what's going on? And I watched this sort of intimate relationship develop over time. And at graduation, the most emotional moments are when students who fly in from all over to have that moment on the stage, even if they've never set foot in Manchester, New Hampshire, thousands of them come in because it's an amazing moment for them to get their diploma in front of their kids, in front of their parents, in front of their spouses, in front of their friends. The most emotional moment is when they meet for the first time face to face with their advisor. And this is the person who knew when you went through a rocky patch in your marriage, who knew when you were struggling at work. They're the ones you called when you had that, oh my God, I just got a D on stats. What was I thinking? I shouldn't be in college. It wasn't right for me 10 years ago. No, let's talk about how we get you the help you need. Let's talk about that, right? But they're also the ones who are sending emergency grocery cards. When you talk about being worried about feeding your kids this week, they're also the ones that when you say your laptop's broken, without having to ask for permission, goes and grabs a Chromebook and puts in a FedEx box and gets it off to you so you can get your assignment done the next day. So it's emotional, it's resource, it's help with resources, it's existential, because fundamentally it's the sense that I care that I matter to the system in which I am engaged. And that was very, very powerful in informing the book. But when I spent a year talking to innovators in healthcare and K-12 and substance abuse treatment, all of them were moving away from scale systems that seek to move human beings out of the mix, because that's what most scale systems driven by what I would call late stage capitalism and technology and Taylorism, they all want to have less human. And what they've all done is a version of what I just described, which is, what's the most important human relationships in the work that I do? And then how do I protect that space? How do I use technology and data to inform and amplify and strengthen those human relationships? And then how do I scale the hell out of everything else? That really is sort of at the heart of the book. Now we can unpack, there's a lot to unpack there, but those are the critical pieces. And then when I hear Sara talk about, a holistic understanding of our students, and one of the things I think that was most important for me, it was a breakthrough in my interview with Sara, was when I had so focused on the people we dehumanize, the patients, the students, the addicted. But Sara said to me, but in these systems, we also dehumanize the people who work within them. We burn out our teachers, we burn out our nurses, we treat them poorly, and then they become complicit in the problem. As I think, Sara, you said, hurt people, right? Yeah.
So, I definitely remember my academic advisor. They were called something different back then. It was so long ago, I can't even remember, but they were very instrumental, right? In terms of, providing those guiding principles and those guiding support systems, if you engaged in the relationship, because it's about building trust, right, with the academic advisor relationship. And so one of the things that you touched on is, people hurt people, right? And people sometimes become complicit because they're mistreated, right? Or they become broken inside of a system. And so, as part of your book, I know that you specifically focused a little bit on the translation on how that, dovetails into racial equity. So I wanted to hear a little bit more about your thoughts specifically on racial equity, and specifically around the Social Justice Fund being a prime example.
Yeah. So when I'm going to back up and come to your question, because if I open up the aperture, one of the things I'm just sort of struck by is how much time, resources, smarts, and expertise we dedicate to the question of curriculum. And what is academics can spend all day long talking about curriculum. And it's important, right? We want to have well-designed learning. What we spend almost no time talking about is everything else that constitute a student's life. And what we saw in the pandemic and our work with Equity, for example, was that we had thousands of people move to Equity to get help. 64% of them, I believe this is right, Kimberly, you probably know this number, or Larry will, I think, was for food insecurity, followed closely by housing insecurity. Like, if you've read the book Scarcity or look at any of the cognitive science around this, you can't study if the only thing you can think about is food. It's not even thinking about my next meal and the way that suggests a kind of planfulness. It's actually more basic. It's like all I can have in my head are images of food at this moment, right? So I think, we are growing more accustomed to talking about whole student approaches in K-12. We have nothing like that by and large, except for places like the Hope Center and Sara's work. And I think a small number of people in higher ed who think about the whole student in the way that we've begun to think about it in K-12. And yet I remember, and Sara, you probably will remember the year, but I think it was 3 or 4 years ago, the Chronicle did an article that reported that nationally, pre-pandemic, 13% of college students reported being food insecure. And everyone was like, what? College students? Because we have this image of, Buff and Miffy on the campus under the tree, throwing the Frisbee around. And that's not the reality. When 50% of our students attend community colleges, when, a large percentage of our students are now parents, when so many working adults are in that mix. And all of what I'm describing disproportionately hits communities of color. In fact, in my first book, Students First, I talk about the ways in which time-based systems of education encourage structural inequities, racism, and inequity, generally speaking, because if you are low income, you have less time and you have less control of time. right? So we see this with huge numbers of people who worked in healthcare, retail, hospitality, food service industries. You may not even know what your schedule is next week, but yet we're going to tell you should be on our campus at 3 o'clock on Wednesdays or 7 p.m. on Thursdays. I don't know. And so I really I'm ashamed to say this because I think probably everybody on this call has known this for much longer than I have. But in the writing of these two books, the kind of baked in inequities that aren't even talked about in our industry, in our discourse by and large, were just increasingly glaring to me as I work through this.
I imagine so. And the data, itself is alarming. So no need to be embarrassed on the time, right, spent, the approach. I think the book speaks volumes in terms of all that's needed to be documented, right, needed to be addressed in terms of some of the things that need to be highlighted with respect to what is on a student's mind when they're part of a marginalized community or, suffering with some stressors, right? And so I'd like to turn it over to Sara a little bit. Sara, you've been quoted multiple times throughout the book, right? For the work that you've done. You've not only brought national attention to the issue of students being humans first and the chronic basic needs and insecurities that students face, but as the leading expert in both policy, how have you seen the field continue to evolve, if they have, with leaders like Paul, and where do you see it moving as we head into 2023?
Well, thanks, Kimberly. I was so honored when Paul reached out and asked if I wanted to chat for this book, and the kinds of questions that he asked made me especially glad that I had taken the time and said yes, because I think that the arguments that he's advancing are things that, of course, I've seen in my research, also in my teaching with so many students over the last 20 years, and frankly, also in my own life. I really appreciated the way that Paul went ahead and reflected and told us quite a bit about where he came from, a part of the world that a lot of us don't know much about. I certainly didn't know much about. While many of my students have walked a very different path than my own, we do have some things in common. I grew up in a home, I don't talk much about this, but I grew up in a home rife with violence. And my schools didn't recognize it. I didn't present in a way that would lead them to think of me as somebody who might be going through abuse at home. And I didn't feel it was appropriate to tell my story. But also nobody asked me. They weren't asking the right questions, so I wasn't opening up. And I see that problem over and over again because we don't have systems and people, frankly, trained in the ways that Paul is, talking about, that would have stayed with me and asked me these questions as if I was a whole human being. And then we have whole data systems like the FAFSA that are official data systems, but really effectively vanish a lot of these issues. So the FAFSA is taken seriously as an assessment of student need, even though, for example, it disappears the contributions students make to their own families. It can leave them looking like they have enough money to survive. And so they're not targeted, for example, for emergency aid. So that's how we end up with statistics like those from research teams that I've led, that show that about 50% of students contend with food or housing. The numbers have been contested in the past, but I'm glad that post-pandemic, most of us seem more ready to recognize these facts, that the numbers are not wrong just because college students are dealing with them at higher rates than other adults. It makes sense. They're facing more expenses, and they're dealing with a system that actually discounts those realities. So some optimism, right? I mean, the good news is that we are having this conversation and we're seeing some good trends. So, for example, we're seeing states step up and not only fund things like emergency aid, which again is not a be-all end-all solution, but it's at least a signaling to the student that we're choosing to see them, ask the right questions, and support them. It's an act of believing in them. We're also seeing states, including, for example, Oregon and others, that are saying we need to put the human beings there. right? So they're asking for basic needs coordinators. And if you're on LinkedIn, you'll see a slew of hiring right now of all of these basic needs coordinators who in turn, to Paul's, quoting of me, in turn need to be humans that are supported in order to do this work. We can't just overwork them, load them up, not give them the technology. If they have to record their notes on pieces of paper in order to do case management or the equivalent, which is like Excel, then they can't efficiently move throughout their day. They quickly get overwhelmed. And the next student who comes through just feels like a burden. That's not what we want to see happening. When we do this work, it seems to pay off, so my dear friend Keith Curry at Compton College, started, like so many presidents, scrambling early in the pandemic to get emergency aid out to students. We were there to help him through Equity, and we were also there to be able to provide some rigorous evaluation alongside it. An economist looked at the data and found that, with a good comparison group, we had effectively doubled the odds that a student would persist at Compton College from May until August that year, from 11% in the middle of the pandemic to 22%. Paul, I believe you've seen similar returns at Southern New Hampshire from the emergency aid and working with Equity. I think there's going to be some new evidence forthcoming from Texas. Stay tuned. So that's exciting. But overall, it seems like things are working. But we have to spread and scale this. And the problem, of course, is that resources are drying up. So there's a tendency, especially, they're not drying up relative to before the pandemic, but it feels like they're drying up because they're going down from the height of the pandemic when the feds were putting in a lot of money. So we have colleges going, oh, I don't know if I can keep doing emergency aid because we don't have HERF. But colleges were doing emergency aid before HERF, and they're going to have to do emergency aid post HERF. And what this means is they're going to have to do it efficiently so that they spend most of their dollars on the students. And they're going to have to do it in a way that rations the money because it is a scarce resource, right? Without putting students through a really tough time, right? We can't make them perform their poverty over and over. And so that infrastructure to be able to support that work and those partnerships with local communities, with other organizations like the United Way, which, Lauren, that's why Lauren's going to be brought into this, right? We've seen at Equity that our community partners have undertaken that work. And so that's what I think it looks like. And that's where I think we're headed. Yeah.
Well, thank you for that, Sarah. I mean, it definitely sounds like scale is where the optimism lies, right? And making sure that it's a shared responsibility and not, individual in a silo. And so to your point, we would like to hear from Lauren, right? Lauren, in the book, Paul references the work of Pamela Hurd and Donald P. Moynihan, who state, as far back as the Nixon administration, welfare programs have not been designed to, balance out the mistaken payments for ineligibility beneficiaries, but it creates administrative procedures that have been used primarily to reduce the amount of benefits that are available. So can you share a little bit about how United Way of Kent County bridged to finish program and how you not only help build a centralized holistic infrastructure for students grounded in caring across 10 campuses, but also coordinated the infrastructure with local government, which is really instrumental to, it sounds like, success of the program.
Thanks, Kimberly. I'm really glad to be here with everyone today. I spent a lot of my career really thinking about how to reduce sort of this sense of scarcity that we have in all of our public benefit programs, whether it be entitlement programs like SNAP and the Earned Income Tax Credit, school meals, or programs that have more restrictions like housing assistance, rental assistance. We do a lot of work, and so much of government's work is sort of keeping people out rather than bringing them in. And so at United Way, we spend a lot of time really thinking about what are all of the ways that we can remove barriers and get assistance to people that need it, and do so in an equitable way. And as Sarah's research was coming out a few years back, I had the opportunity to talk to her and begin to look at data around the country and say, if we really want to address poverty here in our community, Seattle-Kane County, one of the best ways we can do that is by increasing college persistence and completion rates, particularly for students of color and parenting students. And our sort of area of expertise, the thing we could do that was different than others, was around this access to benefits and bringing in more financial, unrestricted financial cash for people that needed it, for those students. And so we looked at what was happening around the country and said, where can we take the best practices and really scale up and show if investments were made? And we were very fortunate to have a board that committed to raise $15 million for this, to be able to really test, can this happen? Is this a way of reducing poverty in our communities? And so we launched Bridge to Finish, which I know there's a few folks on this call who've heard about. We worked across 10 community college campuses, creating one-stop centers, both to connect our students and their families to public benefits, to increase access to emergency grants. So we partnered with Equity and very early on realized that if we trusted students with their emergencies and reduced the amount of barriers to accessing those kinds of dollars, we could truly meet people's emergencies and have them have the resources that they need to meet their food needs, their housing needs, whatever it might be. We were fortunate to partner both with public and private entities to make this happen. And particularly during the pandemic, because United Way held a lot of contracts for other government assistance programs, we were not only able to bring them to our community college students, but to really think about how we prioritize them for this population. And I think, to me, as we sort of move this field and this work forward, it can't just be on our higher education institutions. We've got to have collaborative partnerships, and there has to be money behind that we can braid together to get students the resources that they need in the most reliable, most equitable way possible. At United Way, what we saw is when we did that, it worked. We helped between 6,000 and 7,000 students a year. The team there is continuing to do that. The students that received these interventions persisted and completed at a significantly higher rate than their peers. And I think most importantly, what we've begun to do, but hopefully is what we think about on more of a state and national level with public policy, is how do we not treat all of these different programs as silos, right? The student who is at Paul's College also has kids in the K-12 system. They're also in our workforce systems. How do we ensure that there aren't 10,000 hoops for a student to jump through, but that we coordinate access, we trust students with what their emergencies are, and we get them the resources that they need in the quickest and most equitable way possible.
Yeah, and so my biggest takeaway from that, Lauren, and thank you very much, is a coordinated process, right, with partners, trust in the system, right, building trust in the system from the students or the population, and making sure to the best of ability, right, that it's equitable. And so before we move on, I would like to hear a little bit from Paul, because, bringing the trust factor into the equation, right, and bridging the relationship. I know that Paul speaks very freely about love in his book, right? So much so, like our other equity partner, Russell Larley Hart of another institution, Amarillo College. And so what does that look like in a concrete form for students, Paul?
Yeah, so, the first chapter of the book is called Mattering, and is very much influenced by Greg Elliott, a sociologist, colleague of Sarah's, who's at Brown University. And it's, so the notion here is that we can't build trust if we're not in relationship, and relationship means that you matter to me, right? And for an individual, for a student, I'll stay with higher ed for a moment, but a patient in the healthcare system, for example, would be another example. When I interact with the system, do I feel like I matter to it? So mattering is not belonging, right? We write checks to our professional associations. We go to their conferences. I feel like I belong, and it's important that I belong to my professional community and my and I'm in that discourse community, but I don't have a sense that I matter to them, except for my check every year. They'll tell me if I didn't renew my subscription or my membership. Mattering really is bi-directional. So it means that I not only see you, but that I make myself available to you, emotionally available to you. It's my time. And I was really influenced by my conversations, interview, time I spent with Jessica Benjamin, the noted feminist psychologist at NYU, who talks about this concept of thirdness. So when we are in full relationship, there's a thing that isn't you and isn't me. It's our relationship, right? So if you take a look, for example, in the research on high impact academic practices, undergraduate research is one of those examples where a teacher and a student is together, and a third thing, which is the research project they're working on together. So that's an easy, simple example of this. But when we're talking about the kind of systems of care that are on the table today, then it's really about, I know you in a holistic sense, the way Sara thinks about that. I know your context, the way our advisors think about that. And to do that, you have to be willing to listen and collect people's stories. So the third chapter of the book is about stories. It's about the power of stories, not just the stories that help us validate the narratives we tell about ourselves and our organizations, but the uncomfortable stories, the stories where we are not doing the good job that we need to do, because it's in those uncomfortable stories that we can actually improve what we do. So I spent a lot of time thinking about this very existential question about what does it mean to see somebody in a way that helps them matter, which isn't enough, because the next piece of this is to help them imagine a better future for themselves. In other words, now that I see you, now that I understand you, how do we lift you? Because all of the systems we're talking about are about human transformation. So if I build systems that hold space for a relationship, I don't have to think about what are my policies for governing the edge cases where someone abuses the system, which we get preoccupied as a way of really undercutting systems, in my view. But instead, I know exactly what you need and can help you get those resources you need in just the way that you need them. That's a hard thing to do, but one of the despite the title of the book, everyone who reads it says it's pretty optimistic because it's full of stories of innovators who are actually building these systems. Scale systems of care that protect the human being at the middle. So the second chapter of the book is called Aspiration. How do we help people dream better dreams for themselves? And you can only do that, again, in relationship with people.
That's exactly right. So relationship with people at the intersection of care, right, and love is what I heard.
No one talks about getting out of poverty, Kimber. Sorry, but no one ever sort of talks about their transformation in terms of a policy.
That's
no
right.
one says, God, if it wasn't for that policy, blah, blah, blah.
It's almost in direct conflict, right? A policy plus care plus love, that doesn't even make a sound equation, does it? Right?
No, but what they will talk about is a person. They almost always cite a person.
Right. And so, Sara, I would like to hear from you on this, because this is a construct that you're very passionate about as well. Are there ways to ensure human dignity does not get lost when delivering services at large scale? What can you tell us about this from your research and communicating with students and how they generally interact with institutions?
Yeah, I think that's been one of the central questions that I've been concerned about, because the sheer number of people in higher education has grown over time. Their needs have grown over time, and resources on a per student basis have shrunk. That most of the public still doesn't seem to totally grasp that fact, but it is a fact. And it's created real challenges. I really like the distinction that Paul is drawing between mattering and belonging. Higher education has talked for a long time about belonging. As important to retention, that a student I think higher ed spends a lot of time with the student identifying themselves as a student at this school. And they get very upset. Administrators can get very upset when they find out that if you ask a student, who gave you that financial aid? Many students have no idea that the school did it. Okay. But by the way, my research also shows that many students who get the Pell Grant don't know that it came from the government. And that is a well-known and intentional outcome of what Suzanne Mettler calls the submerged state, which is to say we bury the role of the government. Some of us, not all of us, some of us bury the role of the government. So it's like this invisible hand, like the market. It's doing good things for you. If you don't see it, though, you don't thank it. And by the way, you don't show up and do things like vote. You also don't turn around to your institution and say, oh, I belong here so much that you put money into me. So now let's go and think about the emergency aid experience, just to come back to that for a second. When a student hears, because you're a student here, you are eligible for money, they go, cool, I belong here enough to get this cash. But when they go and apply for it, if the experience that they have is that on a Friday morning, they come and they say, my rent is due and I don't have it, and my kids and I are going to be out of our homes. And you as a human being take that application and say, okay, we hear you. We'll get back to you in a couple weeks. They do not feel that they matter. They might know they belong, but they don't matter.
Yeah.
What does it mean to matter? Well, if your own daughter came to you and said, I can't pay my rent, most of us would act, again, out of love, out of care, as fast as we humanly could to prevent her and her kids from facing even more dire consequences. In other words, she'd probably have help that weekend. I'm not saying we just snap our fingers and instantly cash would fly into our hands, right? But we would do what we had to. So the thing is, it's not like that person receiving the application doesn't want to give it to the student fast enough. I'm not saying that we even have to convince administrators or staff at colleges that they want to do that. They're just humans and they have limitations. And they might very well say, I'd like to get paid more quickly too, or I'd like, to be able to go home at 5, and I still can't have that. So if I say yes to every student, I'll help you in 24 hours, I'm going to be here all weekend. So the question that I was always struggling with was, I really believe in humans. I think that higher ed needs to employ more humans, not fewer. I've always been skeptical of ed tech, of tech generally, and its claims to solve everything. But where tech belongs is where humans literally cannot be, at least not in enough big numbers, right? So tech really does help me manage more projects at one time. Tech really does help me produce a research project faster. And tech really can help me say yes to that student. We will process and get you a decision within 24 hours. And we will put money in your hands, even on a Sunday afternoon, even when we're closed. And for me, that was a hypothesis many years ago. And now, thanks to the work we've done here at Equity, I've been able to see that. And we can in turn see from the students that they do feel like they matter, that they do feel like they were treated with dignity, that they weren't, talked to like children who had to jump through 800 hoops in order to get what they needed for their own kids.
Yes, so resourcing is definitely, something that's always been scarce at higher education institutions. I remember long lines when I was in school for administration. I went to an HBCU, right? It's the bottom of the funnel in terms of resource allocation. And so I understand the scarcity mindset, right? And the hypothesis that you were concerned about regarding, resourcing. And so, in post-secondary institutions, it's there. But Lauren, I'd like to get your perspective on how that, plays out in, community partnerships with respect to resources. I know it sometimes presents a real threat, but do you see opportunities for technology and broader systems to mitigate some of these with the community partnerships that you mentioned earlier?
Yeah, thanks, Kimberly. And, I think Sarah's point is a really good one of most people that are delivering these programs, implementing them, they want to do everything they possibly can to help the person in front of them. And it is often their hands are tied, whether it be a lack of resource, a lack of technology, capacity, whatever that might be. We saw this, my team at United Way administered millions and millions of dollars alongside our community partners in rental assistance throughout the pandemic. And we didn't have an infrastructure to do that before the pandemic. We had to build it. And we had to do that in a way that actually met people's needs in a much quicker way than our back office administration was able to. Many of our partners did the same. And everybody stretched because we were in a moment of crisis. the beautiful thing and the reason that I have come to love equity so much is because it can help solve those things for us. And it's not just about the technology. I think technology doesn't alone solve this. It's about having community partners and thought leaders who come together and figure out what's the actual problem that we're trying to solve here. Is it a resource issue? Is it a capacity issue? Is it a prioritization issue? Whatever that is, Equity and the team that they have there are just so good at working collaboratively, whether it be in education or with community-based organizations like United Ways, to think about what can we do to develop a solution that is going to be put students, put families, put community first, and then leverage his ability to bring technology, bring payment processing to the table, bring research to figure out how do we prioritize when we have limited resources. And as I have learned more and as I've learned from the team there, that opportunity is what gets us from where we are today to a future that is far more equitable in how we distribute resources, that does bring a whole new set of partners together and helps us move away from scarcity into a sense of abundance. And I think when I think about love, I think about abundance. And when I think about what families who are fighting every single day need, it's an abundance, both of love and resources. And together we can do that.
Absolutely. Abundance. That's what we want everyone to be able to operate under, right? Abundance. And so, yes, at Equity, we do thank you for the partnership, right? Technology alone does not solve it. It is part of, a human construct that we're constantly iterating on to make sure that it is a human centered solution, right? Not just a technology solution. And so with that, I think we are just about out of time with respect to this robust conversation. I can't believe we're almost 45 minutes in, but I do want to leave some time for questions. But if there are any closing comments, Paul, that you'd like to make with respect to your book, we can start there and then we'll take questions from the audience. And so I'd like to challenge them to challenge us with some questions in the Q&A section. But Paul, any closing comments?
Yeah, so Kimberly, you said something a moment ago that technology isn't enough. But actually, it's to go further and say the only thing that is enough is human interaction and relationship, and technology has to do everything else. I was interviewed by a reporter in the UK earlier this week about the book, and she said, she specializes in K-12. She said, when I talk to teachers, they say, and I present your idea of the book, they say, wait a minute, I do this. I saw these reports, I take attendance, and now you're asking me, I have to love my kids? I will love it. Like, there's no time for that. And I would say to them, you're absolutely right. We built a system that doesn't allow you the space, protects a space for you to be doing the most important work. And why are we asking you to take attendance? Like, can we find technology to figure that out? Like, let's innovate the hell out of everything else so that we can protect the sort of human relationships out the middle. And I think that's the central point of the book. It's an irony because people say, God, you're always associated with technology and innovation. It's like, yeah, but the real innovation here is about human relationships, which are the hardest kind of innovations.
That's exactly right.
And also the oldest lessons, which is grounded in love, grounded in mattering, grounded in existential questions of care.
Right. And a shared collective curiosity about how do we get there together, right?
Absolutely.
Yep. So, probably 35 minutes ago, the movie, Lauren, do you remember a movie that you mentioned? I don't remember. I know the book. It's broken. That's what we're discussing here today.
There's a question about the movie. It's like, did Lauren mention a movie? I don't remember the movie mentioned.
Okay, well, Lauren, if you can think of a movie that you mentioned, I don't remember one. Maybe Deanna will probe us a little bit more on that one. But Matt has a question. So Matt Reed, sometimes providers struggle with policy compliance. Yes, we've heard that. And policies are written ideally to be, even-handed. Love is not even-handed. So how can we bring this humanistic sensibility to bear without inadvertently sanctioning bias? So I will open that up to Paul to answer first.
Yeah, so Matt points to a really critical point here, right? Which is that systems are not somehow natural law. We design systems. I think it was Denny who said, and we get the outcomes for which we design. So if you design systems that don't actually protect and encourage the human, guess what you're going to get? You're going to get dehumanizing systems. So these are choices we make as leaders. And one of the things that we're doing internally is, and I, just spent time with our chief diversity officer, is we need to move, we're moving her operation to really be focused on equity design and staffing up around equity designers. So every time we think of a policy, and I had one of these happen to me a couple of years ago that just was just a vivid reminder of the inadvertent, right? Like we're not thinking through the equity questions, is that on our campus, we're a traditional campus, about 4,000 students vie for better housing options based on the collective GPA of the other students who are going to share the apartment or the suite, et cetera. So you just pool it, average their GPA, and you sort of get where you are in the pecking order. And I had a mother call me and say, my son works 35 hours a week. Of course his grades are lower. His GPA is never going to, like the kids who don't have to work, of course their GPAs are higher. And he's also in a top major, engineering. So this I was like, wait a minute, I didn't even think about that. Here we were trying to have this carrot about student engagement and get better grades. And yet we were just about, now you might say, God, that's kind of obvious. It definitely got by me. And then we revised the policies around that. But we think that equity design in our systems and our policies are going to be critical. And those are choices we make, not all of them, because as Sarah would point out, we live with regulatory choices that are not as we would design. We'd never design the FAFSA the way it's designed. You mentioned in passing the book Administrative Burden, which that was Sarah's recommendation to me. It's a hugely influential book. But I love the example they used about the design of SNAP benefits. When you give people coupons, you have to pull out of your bag in front of everybody in the grocery line versus an ATM card that looks like you're just using your credit card, right? We know the uptake is incredible because you take the humiliation out of the process. So it is a constant design challenge. But the beauty of this is these are choices we make. We get to make or at least shape, and we can do that.
That's exactly
right. Can I do one piece of this, Kimberly? And it was sort
Absolutely.
of right with all the innovations.
Yeah.
You have to also follow the money and what gets rewarded and what gets punished. And in all of these with all of these innovators who are reinventing systems, they had to persuade insurance companies, for example, with addiction treatment to, hey, you will pay us unquestioningly if I keep ordering drug tests for Sarah. I can order a drug test every day and I'm incented to do it because you'll pay it without even any question. And that's good for my organization because I get a piece of that action. But you limit the amount of counseling sessions I can put Sarah in, when in fact, that's where the important human work happens. My counselor actually knows her. So they persuaded the insurance companies in this one case of this wonderful company that has results 3 times better than the industry average to say unlimited counseling, but we're going to absolutely reduce the amount of clinical services that we charge for. And in the end, insurance company, you will do better financially and our patients will have better outcomes. Our clients will have better outcomes. And it's been working incredibly well. So you have to look at the incentive systems. And in higher ed, a young faculty member at many, many institutions who throws herself into the life of her students and spends time getting to know them and isn't writing the next book and isn't on the right committee and isn't kowtowing to the right associate dean, guess what happens at promotion and tenure time?
I can speak from
experience. We get the outcomes we design. We get the outcomes we design for.
Right, exactly.
Oh, Paul, I have had you as a president. I just want to add one thing to this because there's something inherent in your question, Matt, that I want to mention another book and another issue in all of it. This country and frankly, policymaking around the world has been operating from a framework, right? That works against universalism. Universalism is actually incredibly humanistic in its sensibility. But, as Elizabeth Pop Berman writes in her new book, Thinking Like an Economist, we have been taught to think that universalism is inefficient and less effective. I think we're going to see some reconsideration of that, hopefully going forward. I'm not going to read tea leaves here about where this country is going, but the current approach is not working. So maybe we'll see what happens next.
Yeah.
Well, thank you for those additional comments there. We do have one more question from Deanna Rader. Deanna Green. And I will present this question to Lauren because she speaks of, emergency resources drying up at the same pace of community partners and campuses. And so what do you do at that crossroads, right? When you want to provide emergency aid, but the resources are drying up? What are the creative solutions there for our communities?
Yeah, I think this is a great question. And I think across our sectors right now, we're dealing with this. We had unprecedented funding during the pandemic to respond to the need. And fundamentally, we are going to need more federal resources to do the type of work we need to address the challenges that families face. But in the meantime, what we can do is forge strategic partnerships, right? It is thinking about, if you are a college, reaching out to your local United Way, reaching out to your local governments, and figuring out what you can do together. Oftentimes, community colleges and local universities, they're not the first place that administrators of these programs think about as where the need is. Even though we all know that's where families are, oftentimes it's not the place that folks start with. So I do think it is forging relationships, helping them understand where the need is, the data on who your students are, and what their needs are, and thinking about where are there, whether it be a community foundation, local community action agencies, and that often have flexible financial resources. How can we bridge those things together? Longer term, we need to be working with our state partners on policy issues in order to ensure that there is state funding for this kind of work. And I'm glad to see some state partners on this call, because I think that is really, we've shown as a network, as a field, the need is there, and that when we do this kind of work, it helps our students. And so now we've got to go out there and get the resources together.
That's exactly right. And so I think that is where we will end today. We've had a very robust conversation where we've talked about technology solutions being human-centered at that juncture to make sure that the communities that we want to serve, whether it's students or the communities that we actually live in, feel that they matter, right, in the equation to solving these issues. And so at the discussion point of the book written by the infamous Paul LeBlanc, Broken. And so I encourage everyone to get the book. I want to thank all of our panelists, Lauren McGowan, Sara Goldrick-Rab, and Paul LeBlanc.
Paul is just fine.
For today's discussion. And in the chat box there, Larry has put a link in there for both philanthropic opportunities for creative solutions that Lauren has mentioned, as well as a link for purchasing the book. So again, I want to thank our participants today for joining us. We have a record number of participants as well as our panelists, but I will end there. And if there's nothing else, no closing comments, we will say good afternoon.
Thank you so much for
Thank
having
you
me.
very much.
Thank you, Kimberly.
Thank you.
Yeah.